This is NEJM Group coverage of the 2022 meeting of the American Society of Clinical Oncology. I'm Christine Sadlowski, and with me is Dr. Shanu Modi, the lead author of Destiny Breast 04, a phase 3 study being presented at the meeting on trastuzumab deruxtecan in previously treated HER2-low advanced breast cancer. She's a medical oncologist specializing in breast cancer treatment at Memorial Sloan Kettering Cancer Center. Shanu, welcome.
Thank you.
So, as you note in your study, there is a substantial proportion of patients with HER2 negative metastatic breast cancer that actually have HER2 low disease. What's the proportion?
A good estimate is about 60%, almost 60% of patients who are currently defined as having tumors with HER2 negative or negative breast cancer probably have low levels of HER2, of the HER2 receptor. And so we call those HER2 low breast cancers.
Are these patients who are identified before treatment normally?
So up till now, we haven't distinguished HER2 low breast cancer as a separate group, predominantly because our current HER2 targeted therapies really haven't been effective for this subgroup of patients. And so we've historically treated HER2 low breast cancers as we treat HER2 negative breast cancers. And the treatment in that setting is actually guided by the hormone receptor status. So I mean, we're in an era, a very exciting era of antibody-drug conjugates, and technological advances have really, I think, improved the potency and the benefits of these new generation ADCs. And trastuzumab deruxtecan is one such example. I mean, it is, as you know, already approved and very effective for HER2 positive breast cancer. But we know from preclinical studies that it is active actually across a range of HER2 or levels of HER2 expression. And we actually did a very important proof of principle study actually where we were able to show that even in cases where patients had tumors with low levels of HER2 expression, we saw really promising and exciting activity or efficacy. And that's really what prompted us to do the Destiny Breast 04 trial, which is obviously the very first randomized study of trastuzumab deruxtecan in a HER2 low metastatic breast cancer patient population. So this was a trial, it was actually a multi-center, multi-nation study, and we enrolled patients who had HER2 low metastatic breast cancer. And these were patients who had at least one line of prior chemotherapy, but not more than 2 lines of chemotherapy for advanced stage disease. Moreover, patients who had hormone positive HER2 low breast cancer were also required to have at least 1 line of endocrine therapy and be considered endocrine refractory. And so these were the patients who were eligible for the trial. And so we randomized over 550 patients, half in a 2-to-1 fashion, actually. So 2/3 got randomized to trastuzumab deruxtecan, which we delivered at the approved conventional dose. And then the other 1/3 were randomized to standard of care chemotherapy. And there were a bunch of options for physicians to choose from. These are commonly used drugs in this setting, like capecitabine, eribulin, gemcitabine, paclitaxel, or nab-paclitaxel. And the primary endpoint of the trial really was to look at progression-free survival by a blinded and independent central analysis. And we looked specifically at the hormone receptor positive HER2 low patients as our primary endpoint group. There are a number of reasons for that, but that's the predominant subgroup within the HER2 low population. And so we started with that as our primary analysis group. But we then expanded the analysis to then include all patients, and then in a hierarchical fashion tested also overall survival, again in the hormone positive cohort, and then in all patients on the trial.
What were your main findings?
In terms of efficacy, it was exciting to see that we saw very robust activity for trastuzumab deruxtecan. So for the primary endpoint, which was progression-free survival in the hormone positive cohort, we saw almost a 50% decrease in the risk of progression for the patients who received trastuzumab deruxtecan. And when we looked at median progression-free survival numbers, it really increased from about 5.5 months up to 10.1 months in the hormone-positive cohort. And so we met that primary or first bar that allowed us to then do a progression-free analysis in the whole study population. And we saw actually a nearly identical result. So basically a 50% decrease in the risk of disease progression if we use trastuzumab deruxtecan, and that's irrespective of hormone receptor status. So that was really exciting to see. We then proceeded to do the overall survival analysis. And again, in both the hormone receptor positive cohort and then all patients in the trial, we found the same result, about a 35% decrease in the risk of death with trastuzumab deruxtecan therapy, which is, I mean, it's a really exciting result because we don't often see survival advantage or survival benefits in late stage metastatic breast cancer. So these are really exciting efficacy data.
What patients will want to know about potential side effects?
So in general, I mean, we saw a very similar toxicity profile of TDXD in the HER2 low population that we've seen in our prior studies, mostly in the HER2 positive breast cancer population. So there were no surprising, I guess, safety signals. We know that perhaps the most common toxicity is nausea. And I should say it's mostly a low grade toxicity. We call it grade 1 and grade 2. But we've learned over time that actually we can really minimize this if we use prophylactic antiemetics, and which they didn't do in the trial. So I think because we're now using this drug, I think in our standard practice for the HER2 positive patients already, we can see that if we use antiemetics up front, we can really minimize that potential toxicity. The other toxicities tend to be of a GI nature, other GI side effects, and some bone marrow suppression, which are fairly typical side effects of a lot of chemotherapy drugs we give to our breast cancer patients. And for the most part, these were of a low grade and manageable. We do know that, and we've learned this from the very first trials of TDXD, that it does have a special lung toxicity risk. And we did see that in this trial also. Overall, there was almost a 12% incidence of lung toxicity. For the most part, it was again grade 1 and grade 2 lung toxicity, but there was a 0.8% incidence of grade 5 lung toxicity, and that basically there were 3 deaths attributed to TDXD therapy in this trial. What we can learn from this is that it's important to adhere to the guidelines for identifying and managing lung toxicity with TDXD. And I think if we just look across our whole the TDXD program, that's a key learning. Is that if we stick to guidelines and are monitoring these patients, have a awareness of this toxicity, intervene early, that we can actually prevent the serious potential consequences. So I think based on the Destiny Breast 04 results, I think we are establishing HER2 low metastatic, or we have established HER2 low metastatic breast cancer as a targetable subgroup or population of patients with breast cancer. And traditionally, I think we've been very focused on identifying HER2 positive patients, those patients whose tumors are 3+ by IHC. And so we really have sort of relegated everyone else as being HER2 negative. But now suddenly I think we have an opportunity through trastuzumab deruxtecan to be able to offer these patients improved outcomes with the use of this antibody-drug conjugate. So I think we are going to now have to pay closer attention to the level of HER2 expression and identify the 1+ and 2+ cancers because they may be able to benefit from this new therapy.
Is there another trial that's needed before you would recommend putting this into practice?
I mean, I think that the results from Destiny Breast 04 are pretty robust and compelling. And like I said, it's really exciting to see that we can improve survival for late stage patients. So I'm pretty excited and hopeful that this is going to be something we can offer to patients in the near future. There are, a lot of, I think, interesting ways to build on this trial. There are already actually some studies underway. Destiny Breast 06 is another large randomized phase 3 study in the HER2 low population, specifically for hormone positive HER2 low patients. And it's in a less pretreated population, so none of those patients will have had prior chemotherapy. And additionally, they're looking at a population of patients we call as ultra low HER2 patients, where the IHC score is less than 1 but greater than 0. So really trying to define the lower boundary of HER2 low, which is, I think, a really important thing for us to do. And there's a potential that in the future we may even be able to open up this therapy to a larger group of patients, frankly, based on that analysis. So there's also a very important trial looking at combinations of different therapies, again, for the HER2 low population. So a lot of really exciting things to look forward to. You know, we're seeing for the very first time that we can target, you know, low levels of HER2 in breast cancer. I think this is a real new group of patients we're going to be able to, you know, provide their targeted agent and really improve outcomes. So I think it's important now for us to focus on identifying these patients so that we can open up this really exciting treatment to a whole new group of breast cancer patients.
Thank you for sharing your research and discussing it with me today.
Yeah, my pleasure.